Thank you. So we are having a bit of an issue with the cart right now, but we are working to resolve it, and we are going to get started. So I know it's, the afternoon, it's after lunch. Hopefully we can all, stay energized, stay present here. I'm really excited for this panel session today. For those who don't know me, my name is Priya Nair. I use they, them pronouns, and I'm the Deputy Chief Diversity Officer for the Governor's Office. I'm here representing Julissa Gutierrez, who is our state's Chief Diversity Officer, who couldn't be here with us today. And I also want to acknowledge two of my colleagues here in the room, Jay Frazier and Daniel Dobies. Please come talk to us after. We are a friendly bunch. So our team works on statewide strategies to ensure that the New York State workforce is as diverse as the state, to ensure that it's an inclusive workplace, where all employees can contribute and can thrive, and that we're really advancing equity and embedding equity into our state's policies, programs, and operations. And we know, right, in the Office of Diversity and Inclusion, that accessibility and people with disabilities should be a central component of our diversity, equity, and inclusion initiatives. But unfortunately, sometimes folks with disabilities aren't always a part of those DEI initiatives. And that's really why we're here today, right? That's why we put together this panel today, in order to highlight the DEIA practitioners in New York State government who are really trying to prioritize accessibility in their DEI strategies at their agencies. At the Governor's Office of Diversity and Inclusion, we have been closely collaborating with Kim Hill, our state's Chief Disability Officer, and Ben Thapa at the Office of the Chief Disability Officer. And we're really just so grateful for their partnership. It's really a joy to work with them. And also, this is an amazing symposium today, right? Like, congratulations. This is incredible. So great job. And I just want to end by saying, we know there's so much more work to do on accessibility and ensuring equity for people with disabilities, right, in the workplace and in New York State. But we are hopeful that this panel will inspire new ideas, new accountability and commitments to really upholding the A in DEIA. So thank you all for being here. I hope you enjoy this exciting conversation. And I will kick it over to Ben, who is going to be our moderator for today.
Thank you. I'm never quite sure how long to talk, so if I need to go higher, let me know, raise the roof, do all that, or, a little bit lower. So my name is Ben Thapa. I happen to be 90 to 95% deaf, and so I have wonderful interpreters here. The cart hopefully will kick in at some point. Oh, we're good? Okay, great. Thank you, cart person. So I work for Kim Hill at the Chief Disability Office. I guess my job is a little bit of everything, but disability touches upon almost every element of life, and so I guess what I do is try to solve problems to give everybody access and to make everybody feel welcome, not only in the environment, but like where they are, where they work, and to give people the ability to have choices. So, okay, I'll toss it over to Dr. Amir.
Hi, everyone. I'm Hira Amir. I am the Chief Diversity Officer at OPWDD, which is the New York State Office for People with Developmental Disabilities. I know some of my colleagues here plan to do a little bit of a kind of a personal take, and so I just wanted to add in that my own kind of passion for government comes from having used food stamps, Section 8 housing, temporary assistance for needy families, and a lot of other life-saving government services. So kind of that experience of having government services kind of help my family, thrive in the United States, especially in New York State, is the lived experience that I bring to my work as the Chief Diversity Officer. So then passing it over to Angelica.
Thank you. Hi, my name is Angelica Kang. I use she, her pronouns. I'm the Chief Diversity, Equity, Inclusion, and Accessibility Officer for the Office of Children and Family Services. It's a bit of a mouthful. I am here today, I want to say first with a lot of humility. I do not have a disability. I do not have that lived experience of knowing what it's like to have a disability. And so I am still learning. I will not claim to be a subject matter expert. I'm a practitioner of equity, inclusion, and it is critical to me. I have learned in the past couple of years how critical it is to ensure that accessibility is part of my portfolio. I also want to say, though, that despite not having the personal lived experience of having a disability, I do love and live with a person with a disability. He has a traumatic brain injury, and through a lot of patience and resilience, he has taught me quite a bit about my own ableist ideas and views and the ways that I perpetuate harm. And I have his consent to say this as well. I did ask if I could say it, but I am learning about how that experience is valuable too, to be the loving partner of somebody with a disability and the challenges that brings both in our experience of existing in the world and with each other as well. And that human experience is what I like to bring to my work. Thank you.
Hi, everyone. I'm Carmelita Cruz. I'm the Executive Equity Officer for the Office of Addiction Services and Supports. We all have very long titles and very long agency names to introduce ourselves. I use she, her pronouns, and I'll share a little bit about myself as well. So I actually grew up in a family that experienced substance use and mental health issues. So it really drove my work. I don't think I would have gone into law school saying that this was where I would end up a decade later, but it's definitely worked out that way, which has been great. Before coming into state government, I have a social justice and harm reduction background, so I also bring an advocacy spirit into my work in government, which I think is a little bit different, but we're seeing more and more advocates under this administration join state government, so it's very welcoming environment, and it's great to be here with you all today.
All right. So I'm going to ask a two-part question, starting with Dr. Mir, then moving on, and then the next question, Ms. Kang, and then so on. Two-part question. First part, what is one thing your agency is doing that you're proud of that improves disability equity and access to the services delivered? Second part, what is one change in the hiring process or the overall physical accessibility or digital accessibility in your agency that has benefited employees?
So Ben, we're actually going to start with Angelica first because that's our thing. That's what we decided, if you're okay with that. So go ahead.
Okay, so what I'm proud of at OCFS, out of the Office of DEIA, is so I started this position in December 2021, and you know, when you join on, you do your listening tour, you go around and you talk to your partners, and I was going, and so the Commission of the Blind is one of the commission's divisions that is housed under OCFS, and so I was meeting with their director, is that director? Associate Commissioner, and staff, and I was all, you know, new and ready to set the tone and to come in. And my listening tour, you know, I was very committed to listening and to hearing the voices. And like immediately, one of the very first things that I heard was basically a real challenge. Like, your position is going to be a bit of a joke if we continue the practice at OCFS of sending out materials that are not accessible to screen readers. And it was just, you know, there was this moment of just being like, oh wow, like within my first couple of minutes, it feels like here, it's been called out that we have a real issue. And so that was when I have a very supportive executive leadership team. My teammates are very supportive, and so I was really able to use this opportunity that I had just gained about being a person in a position of power and leadership to just say, all right, we're gonna add accessibility to this portfolio. We're gonna add the A there. I heard you loud and clear. I have no idea how we're gonna do it. And I know that as like the expert, I'm supposed to have a plan before I make a proposal. But this was one of those things where it felt critically important to set the tone and the priority before I had a plan. Even if that doesn't go like with practice, typically you want a proposal and a well thought out plan that has like concrete measurables and deliverables, right? Like government loves that. But I couldn't do that. I just knew we had to respond. So that's something that I'm proud of, but that's certainly not enough. And I will only be proud of it if it actually continues and is a sustainable effort. So to be determined. Am I proud currently? Yes, but that is, that challenges us to be accountable to the commitments that we make. So there is a chance that I could be a tiger mom and disappointed in everybody. And I'll make that clear if I have to be, right? And then the second part of the question was, so then, small actions which will lead to greater change. My hope is that that's what's going to happen. But I kind of made it like my thing for a minute to just rattle the chains about the accessibility. Like, I think in bureaucracy we're very caught like with sending messages up the chain. And one of the really great privileges I have in this position is to cut through all of that and bring it straight to the voices of my colleagues who sit in cabinet. And that is, if that's what I can do, I say that I'm not a subject matter expert, but if I can use my positionality and my power as a person in leadership to just bring that to attention, I will. And so hopefully, I'm not the only one who thinks this, but at OCFS, we have greatly improved our communications and ensuring that agency-wide communications that go out have been tested for accessibility. That is not an afterthought, that we are thinking about it from the get-go. It is part of the checklist, right? You check for grammar, you check for spelling, you check for accessibility. It's part of our practice, and we will continue to implement it until it is seamless and not something that we even have to think of, and it's just part of our natural practice.
But I think you can understand why we want her to go first. But I want to, before answering that question, I do want to give an overview of OPWDD because I think that's important. We are a very unique agency. So OPWDD actually is the second largest New York State agency. We serve over 120,000 people with developmental disabilities. And so developmental disabilities include cerebral palsy, intellectual disabilities. Is there a tone? I think there's a, yeah. So we serve over 120,000 people with developmental disabilities through a variety of supports and services, making us the second largest New York State agency. So an incredibly large government body. In addition, OPWDD itself is a provider of services, and we are the largest provider of services in New York State with over 12,000 employees, providing services directly to 9,000 people with developmental disabilities throughout 1,000 sites. And so one thing that we've really been focusing on in this last year is understanding intersectionality and understanding intersecting identities. So while we serve over 100,000 people with developmental disabilities, that's part of the work that we do, but within that population, there are people experiencing a multitude of isms. You have people with disabilities who are immigrants. You have people with disabilities who are from low-income neighborhoods. You have people with disabilities who have a variety of communication styles, spoken, non-spoken, and just really understanding how do you weave that understanding and how do you respond to that diversity throughout the very fabric of your agency. And so we've taken you've made a commitment to understand, gone through a lot of intense professional development in that area, and really just tried to strengthen our internal infrastructure to be able to respond to that kind of diversity that exists within a population of developmental disability. So I know there's more questions where I can go into some of the specifics. And I also mentioned that OPWDD is the largest provider in New York State of DD services, maybe in the country or the world, but I don't have the data to back that up. And within that, our Division of State Operations, I'm just incredibly proud of the work that they've done to weave diversity, equity, inclusion, accessibility, cultural competence, and linguistic competence into 3 specific areas. And those are recruitment, data, and their policy throughout state operations. And so that's building the infrastructure to do this work for years to come. And with that, I'll turn it over to you, Carmelita.
Okay, so being from Oasis, I want to talk a bit about programming that has been developed for people specifically in recovery. So Oasis developed their own credentials. So there's a peer credential, certified recovery peer advocate, and a KSAC credential, which is a credentialed alcoholism and substance abuse counselor. We have too many acronyms in government. I'm surprised I could remember that one. So, you know, they are really credentials that have created employment opportunities for people in recovery and created a career ladder really for people in recovery, both in our regulated programs, but also in the 12 addiction treatment centers that we operate. So we have actually created civil service positions, right? We've also really invested a lot of funding, state funding, federal grant funding, opioid settlement funds, in creating scholarship opportunities so that we can also help folks overcome financial barriers to attaining, additional education and training. And we have also, through regulation, required our programs to have staff that are certified peers and that are KSACs, right? So we are creating the credential, we're providing the funding support for folks to obtain those credentials and making sure that they have employment opportunities within our system. And I think that that's something that I am very proud of our agency really investing in. And I also wanted to say, just if you look at all of the research, right, in terms of getting folks to enter care, in terms of getting folks retained in care, people with lived experience, right, are far more successful at doing that than physicians are, right, than nurses are. So we're really also investing in expanding opportunities to services for people using substances in the state. So I'm very proud of that. So I'll turn it back over to Ben, I think, right?
What are two things that make a strong DEI initiative or program at a state agency level? Probably start with Carmelita.
Two things. Okay, so my list of two things has 5 things on it. So I'm going to say first, including people with lived experience at the table, I think is something that's really important. Obviously, something that comes with me from being engaged in the harm reduction community, right? I don't think that as government we have all of the answers. I think we really have to look to the folks in the communities that are impacted to help identify solutions to what our issues are. And then I think the other thing is leadership commitment, right? Not just leadership buy-in, but a leader who is actually really committed to the work that is being done. I think that buy-in is fantastic, but when we have leaders that are committed, we're going to plans that are much more successful.
It's okay. So 2 things. I would say the first one is ensuring that the voice of those with lived experience is elevated and drives the conversation and drives solutions, and that despite bureaucracy and despite the chain of command, the folks whose voices need to be heard are heard, and decisions in terms of policy and practice are modeled after the input that they have provided. And a more concrete example of how we're doing that at OCFS is that we have created an accessibility work group that is employee-led, populated full of employees with lived experience. Well, actually, it's open to all. We have prioritized folks with lived experience, but we are not requiring self-disclosure. If you want to be in this space, you can be. And the way that the ODEIA office at OCFS works is through a lot of subcommittee work, because I don't have a full, as prolific of a staff as I would like, and because of how this is a growing field, we're not at the staffing levels. And so we are still asking people to give their labor for free and to lead in some of the solution and decision making. But we did create the subcommittee as a bit of a brain trust for me to elevate voices, for me to identify our pain points and places that we can be doing better. And as also to identify our strengths, right? Like we also are identifying folks who have really great partnerships with their supervisors, or folks who are able to navigate the reasonable accommodation process in a way that they can explain it to their colleagues, so that there is support in this process that could be new to some folks. We are examining the universal design of what we're planning to. This is all aspirational because we are still in the throes of creating this group, but these are the goals that we have concretely and on paper committed to, and so they will be done. But we are looking at our universal design and access because we know that there's the curb cut effect, and that, you know, what works for one is going to work for all. And we're driving this conversation through this subcommittee so that employee voice is critical to it, and that I'm not just unilaterally making decisions, especially because I come before all of you saying with a lot of humility that I am still learning, and I am still trying to figure out how do we actually make this a priority in a true and genuine way. So that first strength is the employee voice and ensuring that it's not just for show or window dressing, but it actually truly forms what we're doing as a follow-up action. And then the second really critical step that we are taking and working on, and it's a continuous process, is fighting a scarcity mindset when it comes to DEIA. We often kind of get stuck in the oppression Olympics, and we also, because of the fact that there is a limited amount of resource for the oppressed and marginalized, we have to fight each other for resources. We have to fight each other for voice when we're talking about equity and inclusion for everybody. And so we really have to work on this kind of instinct to say, what about me, when we're talking about other people. And that is not something that I think we necessarily are expected to address in the workplace. But if we are going to be a human services agency that truly serves the humanity in all people, these are questions that we do address and are compelling our colleagues to address. How do we fight the scarcity mindset? How do we truly set what, you know, your own kind of best interests? I get the desire to protect that, but I get that that's created by an external system that we exist in. And I'm trying to help folks identify their place in that system, and that their responsibility is to fight that, regardless of whether or not the outcomes are going to benefit you personally.
So I also, like Carmelita, had a couple of things, but I'm going to highlight one, I think, opportunity for New York State that's pretty ripe and incredible, and that's language access. So when we've done work at OPWDD, focus groups, listening sessions, forums, community forums, language access is often elevated as a top barrier to accessing OPWDD services, mental health services, educational services, government services throughout. And I think that in New York State, we have an incredible opportunity to really invest and build internal infrastructure at our agencies to do the work of language access. OPWDD hired our first full-time language access coordinator this year. We are one of the few agencies to have a full-time person in that role. So for the agencies that are out there, I highly encourage attention being paid and investments being made to that particular kind of area. In just the Since March that our language access coordinator has been hired, we fulfilled 350 requests for language access. And in New York State, we have a law that requires agencies to translate things into American Sign Language and the top 12. But I just want to read aloud some of the languages that we've fulfilled requests for just in the last few months, because I think it's important to recognize the linguistic diversity that we have in New York State. So we've fulfilled requests for Burmese, Pashto, Dari, Nepali, Dinka, Amharic, Swahili, Tamil, Karen, Vietnamese, Tagalog, Kinyarwanda, Uzbek, and many others. And so this is just, I just think there's an incredible opportunity for OPWDD, but also New York State in general, when we're talking about accessibility and making information accessible, and just helping people to understand government services and how to get those services. Carmelita also hinted at this. communities tell us what they need. And so at OPWDD, we've partnered with our New York State DD Council, with several immigrant providers, with our Office for New Americans, with providers who specifically specialize in communities who have disability and limited English proficiency, to work with them to co-create materials. So it's going from translation to transcreation. And one example is, we worked with Synergia, which is a DD provider who specializes in serving the Hispanic community, and our Chinese American Planning Council, which specializes and is the biggest Asian American service provider of DD services in the nation. And they gave us feedback on accessibility of our services, understandability, and with them, we're actually redesigning our front door sessions. And we're doing voiceovers to start in Spanish and Mandarin with closed captioning and ADA compliance. And so just really working with the communities because they know what they need and they know where the breakdown is, and working with them to create meaningful information together. And so, you can call that community engagement, cultural competence, linguistic competence, but putting it simply, it's communities know what they need, and they can tell us what they need, and we can work with them to redesign.
I want to use this opportunity not to brag for my agency or entity, but when we went to the Office of Language Access led by Margarita Larios and Alejandro Cintron to talk about language access, the law, I believe, requires the top 12. And we said, well, could you add sign language? And, I'm sure other people come to them. And the response wasn't no. It was, yeah, sure, let's figure out how to do this. So they began producing a series of videos that are all in ASL. They're wonderfully produced. And this is something that they have done consistently for, I think, the last 4 months straight. And that we've started with the emergency services like Office for Temporary and Disability Assistance, domestic violence, if you've lost your job, all of these things are the things that people would need quick access to. But we would like to see eventually agencies and other entities start, working with Office of Language Access to do this themselves, because as you've all mentioned, inclusion is quite important. I did want to come to the final question here of, when we say advancing inclusion strategy, what does that mean for you right now? What are you building on? What's the current landscape? And what's over the horizon? What are you looking at and aiming for? So, Carmelita, you want to start once again?
Sure. This is such a loaded question. I have a lot of responses to this one too. So I continue to build off of, that impacted communities, impacted people need to be a part of developing the solutions. So internally at OASIS, we have an internal advisory council, comprised of staff from across our agency, which is really diverse, The state is very diverse. We have offices all over the state. We have an administrative side of our agency and a direct services side of our agency, because we operate 12 addiction treatment facilities, which are residential settings for treatment for substance use disorder. So there's a big difference between the administrative side of our agency and the direct service side of our agency. So really bringing those folks together in an internal advisory council. We also just implemented, went through the process of holding an equity survey within our agency. We worked with an external vendor, and the results are really helping us to develop a roadmap for how we address the culture within our agency, and also the opportunities that we're creating for our staff, We want to be able to recruit a diverse staff, but we also want to be able to retain those folks once they're in our agency. So what are the other professional development and skills development opportunities that we can create for folks once they're at our agency? We're looking at all of that, and we have this really fantastic advisory council of staff who are helping us to develop that. Externally, working with our provider community, I am very, very, very proud and happy to say that we're in the process of creating a peer advisory council, of folks with lived and living experience with substance use and gambling. And the application process is open right now. You can get the link from our website if you're interested or know someone who's interested. that's huge for us, right? That's not something that our agency has had before, and it's an advisory panel that's really going to help us as an agency in terms of policymaking and funding priorities as we move forward in the future. And within the next year, we're also working on creating a provider advisory council, right? So that we really focused internally on staff development, on impacting our agency culture, on creating a roadmap for what happens internally at OASIS, knowing that, right, we were investing in our own staff first before we went out to the community and started to have these conversations with our provider community. So within the next year, we're really focused on creating a provider advisory council, very similar to our internal advisory council, who are really going to work in partnership with our agency as we look at evaluating the policies and practices that our agency has in place.
Is it me next? We're just going down the line? Okay, so I'll be frank, which I think I'm known for. What's my strategy? My strategy is to have a strategy. I am here, I'm in this space, I got into this space through the pathway of race equity. You know, we know that it's a public health emergency. Racism in America is a public health emergency. And racism, inequity, oppression of marginalized communities is baked into the system of American governance. And it informs the oppression and marginalization of everybody else. And so I've come to this place through that pathway. And so because I've been responding to a public health emergency in a government institution, and this is a growing and developing field, and the urgency of the moment didn't really seem to be encapsulated by the American public until just a couple years ago. I have been in survival mode for a really long time, and I think a lot of practitioners in similarly situated positions are as well. And I think that's actually part of the strategy of the system to keep us from making real change, is to keep us in survival mode and responding to fires and responding to this in-the-moment crisis of of the world falling apart around us. And so I have been trying really hard to respond to the moment, but also make sure that we can scale back and look at, like, how do we strategize to defeat this system that is trying to keep us oppressed? How do we do that? And I have to actively fight the urgency culture. I have to actively fight this desire to respond to the little kind of whack-a-mole situations that I think is going to solve the crisis of inequity. So, you know, I want to admit that, like, I'm sitting here on this panel, not as an expert, like I've said, because I'm still wondering, how do I do this? Because some of it is transformation of mindsets, of just including the A, remembering that accessibility matters, reminding folks, and constantly just, we're getting there. We're starting to think about it as a first step. But I think we would be disingenuous if we said that we were already there, of constantly knowing that when we talk about equity, it means accessibility, and it means involving, and not just involving, but listening and implementing the voices of folks with lived experience. So that's big picture. What would it look like in the future? I mean, I am so aspirational. Like, I have, like, all these crazy, like, ideas that I don't know how I'm going to get accomplished with all the systemic barriers in my way, but, like, I would love to build out entirely new work sites, honestly. I mean, we've talked a lot with folks with neurodiversity, and how they want to thrive in the workplace, and we do not have an environment that lets them do that. And I want to respond to that, and I have ideas, but I need a lot more than just ideas to really make that happen. In the future, I would love the burden not to fall on our employees, to share the harm that we've inflicted on them as a motivation to change our behavior. I would love for there to be a position with support staff that drives the conversation, and that we are proactive and not responding to the harm that we have done to folks. It's about rebuilding and repairing relationships, and I haven't necessarily seen that in practice yet, and so we are trying to discover what it takes to do that. And again, it's kind of nebulous. It's not a real strategy. It's hard to put on paper, but that's my commitment, I guess, is what I can offer.
I feel like that's where we should have ended, but I'm sorry, now you got me. So I have 3 pages of notes for this question. But I wanted to share that I've been in my position now for a little over a year, and one of the first agencies or organizations to reach out to me in my position was Milneck Services. And I know some of you are here from Milneck Services. I can show you, I actually wrote this down, so I'm not just, pandering, but Milneck Services was created with a simple premise in mind, and I'll read it, to provide deaf and hard of hearing individuals equitable access to community services and programs, including job development and career training, supportive living, and community socialization, advocacy, and additional resources as needed. And so Milneck Services shared several examples with me and the DEI office about where in the ways in which they interact with government services and OPWDD services, where we could be doing better. And one vision that they shared was that when we have our communication, especially our written communication, that with that written communication comes a video, of sign language interpretation. And what would it mean for that to be the norm, that we think about those things in our day-to-day communication. And I think that that's something very attainable for New York State to do. So I wanted to kind of elevate that as a very, it seems like a very simple mission, but and very simple vision, but those of us who work, in government, we know that it takes a lot to build, the internal infrastructure to do that. So, just taking it back to language access, there's ways in which we're trying to build our infrastructure with our vendors. There's ways in which we're trying to build internal kind of staff capacity that will outlive us. And there's also policies and regulations that we're taking a look at. So in OPWDD, we've added language access to our regulatory agenda for the very first time, I think, since I've been there, which is really, really incredible to have, the agency commit to an area where we're going to do research and we're going to look at our regulations and we're going to create policy, from that perspective. So I think that that's kind of, for the future and something very, practical and attainable. So I'm going to go to my second page. Additionally, as Angelica was saying, we have a commitment, but we're really just getting started. And some of the ways that OPWDD has gotten started is, in the last 6 months or so, we partnered with a university, Georgetown University, to just learn, what does lived experience mean? What does equity mean? What is disability justice? What is cultural competence? What is linguistic competence? And just what is intersectionality? So just learning about these terms and learning about these frameworks. And for the next 2 to 3 years, we've committed to undergo kind of internal review processes. So take a look at our policies and work across our leadership team and across our agency to identify policies that we can look at from the perspective of DEIA, cultural competence, linguistic competence, and intersectionality. We've started our vision to action planning, so we want to create a vision plan for cultural competence, linguistic competence, diversity, equity, and inclusion. We're also going to be workshopping definitions, our agency definitions, and hopefully sharing them with our entire, community of providers, which is around 600 or so nonprofit providers who we, provide oversight to. Additionally, we're committing to staff training, and as I mentioned earlier, we have over 12,000 employees, but close in our state operations, but 17,000 across the agency. So really thinking about internal infrastructure and external infrastructure, and just really making an intention to lay the foundation for the next 10, 20, 30 years. I just kind of wanted to highlight one important thing. Lastly, that in June of this year, our DEI office, in partnership with Georgetown University, held virtual forums where we introduced, kind of the project and the work we're going to be doing in this area. We had 650 people attend those virtual forums, and over again in those forums, people emphasized the need for OPWDD to focus on people with disabilities from rural communities, people with disabilities who don't have access to internet, people with disabilities who are undocumented, who have various immigration statuses, people with disabilities who are deaf, hard of hearing, use a variety of sign languages, speak languages other than English, communicate in a variety of needs, people with disabilities who are also religious minorities. And I think speaking to what, Angelica was saying, that there is a demand for this, and people are asking for the agency to respond. And so we are trying to make a commitment to learn how we can respond. That's it for now.
Thank you for those answers. We have room for a question, if anybody has one. Owen, do you want to see?
Yes, so I just have a question, since we're talking about this specifically in terms of accessibility and how accessibility fits into DEI and how we can incorporate it into DEIA. I don't know how the structure is in your respective agencies, but what is your relationship to your agency's ADA coordinator and your designee for reasonable accommodations? Are those under the umbrella of DEIA? Or if they are a separate entity, how do you incorporate your communication with them to make sure that you are actually working together to achieve this end of incorporating this into a full program?
I'll start first, and then we can go down the line again. For our structure, right, I know there are other state agencies where reasonable accommodations fall within the equity office. At OASIS, reasonable accommodations sit within human resources. We do consult with human resources on some of the reasonable accommodation requests, but it's a function that's held predominantly by HR and counsel's office in OASIS. We do also work with our ADA coordinator, right, on any questions that are coming in or issues that are coming in, both from internally to the agency, and then also any external issues that might be raised. And then just to build off of some of Hira's comments, our language access officer is actually here. The language access office does sit within the equity division at OASIS as well. And I'll just add to that, I agree 110% with what Angelica is saying. Accessibility is something that our agency is working on, and we have really fantastic partners at the other state agencies. We sit on the Disability Council that's operated by the Division of Human Rights, and another member of our staff who's actually working on accessibility guidance is here. It's in very early stages and being shared with advocates right now, which is really great. But I would say, we are all learning, right? We don't. I also don't pretend to be an expert on everything, and this is definitely something that our division is really working on, and really relying on our partnership with advocates to help guide us as we develop any of the materials that will be used internal for our own agency staff, and then shared externally with providers as well.
So likewise, our agency does not house the ADA process. I'm a lawyer, or I was trained as a lawyer, and so I understand the world of compliance and legal guidelines. And I want to, well, let me also start by saying what I'm about to say is not trying to lay blame on anybody or anything. It's just a transparency, kind of an observation of where we are right now. That is not just based on purely like my anecdotal experience, but from listening to voices and kind of looking at systemic patterns. I do think that the COVID had a huge impact on the RA process. I think that it caused a lot of pain for everybody involved in this process. That is what I'm hearing when I talk to folks about how is the reasonable accommodation process going for you, both as the people or persons in charge of implementing a program, people who are charged with upholding a program, and people who are trying to participate in it. There are pain points everywhere. And so my job as the DEIA officer is to address those pain points and to try to tackle like what is going on here. And in my position, I make it pretty clear that I don't want to come from a world of compliance and regulation and that be it. I think that's an easy answer oftentimes for us to not delve into the harder questions. So I could easily say, no, ADA and RA process is not under my purview, and I've been, and I don't want to overstep my role. That's not my role to try to change a process there. What can I do, though? It doesn't stop there. What can I do is try to rebuild and repair some of the harm that has happened, or not even the harm, but just the tension, the discomfort, the kind of, the issues with the process. And I think it's a lot of a lack of communication, of things happening in silos. And so we have begun talking about what can we do for everybody in this process to transform it so that it is not a burden for anybody, but an opportunity to make our workplace more accessible and inclusive. And so we've got conversation going on now about, possibly templates for, better paperwork or support, even just creating like an employee resource group for support in terms of like, if I did develop a disability and I needed to go into the RA process, I wouldn't know the first step, and I wouldn't even know like the psychosocial supports that I needed. If there are other people who have been through the process and can help me identify what I need, because I think it's also that I know what my disability is, but I might not necessarily know what I need to make me able to thrive and be successful in my job. Perhaps folks with a little bit more lived experience or knowledge can help me get to that place so that it's not this process where it feels like there's sides, but that we're working collaboratively together to really come up with solutions. And again, not blaming anybody. I just think the environment where a lot of civil rights and social justice has come out from a place of litigation and enforcement, and that is really, really helpful, but at some point we do have to transition from this is the law and this is the enforcement of it to the human aspect of, okay, what was the intent behind the law? What are we really striving towards? What is our North Star here? And I think it's beyond paperwork and compliance and checking boxes off. I would love for it to be a place of understanding and support, mutual support and respect for one another.
So just adding to that, often when we think about the state workforce, I think the frontline workforce or our direct support assistants, our direct support professionals are often not considered. And at OPWDD, almost 50% of, or I think close to 5,000, 6,000 of the commissioners here, so please forgive me if I misquote some of the numbers, but close to 5,000, 6,000 of our employees at OPWDD are direct support assistants, and they did not work from home during the pandemic. A direct support professional works, often one-on-one, supporting a person with a developmental disability, helping them, live their lives, providing 24/7 support. And so just understanding what a policy or an accessible policy would look like for a direct support professional, many of whom, at OPWDD are, Black and brown women who are, at the lower grade levels, right? So what does accessibility mean to that workforce is just a really big question that I think that we have to consider as a state workforce. But also to answer your question directly, the Reasonable Accommodations Unit is not in the DEI office. It's overseen by our Division of Administration, so where HR personnel is, and there is a strong relationship between, Council's office, Division of Administration, and the DEI office. So it is a kind of a three-way partnership, but overseen by the Division of Administration as a direct answer to your question.
Ben, can I add one thing to that? So reasonable accommodations are in HR for a reason. Executive Order 187 put reasonable accommodations under HR. I think that's correct. I see ODM staff here. And so the Office of Diversity and Inclusion Management oversees reasonable accommodations, and there is a statewide policy. So it's important to know. So kind of traditionally, ADA coordination, not reasonable accommodation, but other ADA coordination has been separate from DRA. At my agency, they're together. I only know that because I'm ADA coordinator and designee for reasonable accommodation. But there may be some changes down the road where that changes a little bit over who can do reasonable accommodations as we move forward. I'm not sure. Department of Civil Service, I'll let them speak to that. So I think it's important that sort of by design, they haven't been together. but that could be changing in the future, especially as we have these discussions.
So I wanted to add one thing in that. Is this on? I'll add one thing in that the Chief Disability Office is the statewide ADA coordinator. There's a whole bunch that goes into that. We can get into that later after time. I want to thank our twin CDO office, the Chief Diversity Office, Julissa, Priya, Jay, and Daniel for being here. You got that screen. So thank you for giving us your time. I hope you enjoyed this. We are probably going to open the questions afterwards, and rest, recharge, take care of yourselves. Let's get at it.